Hi everyone, welcome to week 7 of Lifestyle Medicine 101. This week we're going to be talking about avoiding risky substances. My name is Christy Baron. I'm a licensed clinical social worker and a certified health coach. I work at North Colorado Family Medicine in the residency program as one of the behavioral science faculty, and I hope you enjoy our presentation today. First of all, I have no disclosures to report. Our objectives for today are to first talk about why is this important? Why is this something that even matters? How do we define what a risky substance is? What do we mean when we're talking about that? What are some physical effects of substance use? Why do we use substances? What are some alternatives to using substances? And then finally, some resources for you to look into if you're interested. So first of all, why do we care? Why do we need to worry about avoiding risky substances? Well, obviously, it's one of the 6 pillars of lifestyle medicine. That's why we care. Secondly, as most of you probably are already aware, the use of risky substances is highly correlated with heart disease, cancers, and lots of other health problems. One of the whole goals of lifestyle medicine is to lead a healthier life. So obviously avoiding those substances would be one way to do that. So what substances are we talking about when we say risky substances? A lot of times people just automatically assume things like drugs, heroin, methamphetamine, all these other bad things, but we're actually going to talk about 3 substances that are very commonly used and are also legal in the state of Colorado for adults to use. Those are tobacco, alcohol, and marijuana. So first, tobacco. Pretty much everybody knows using tobacco is not good for you, but here's a statistic you may not be aware of. According to the CDC, tobacco use is the leading cause of preventable disease, disability, and death in the United States. Number 1. So how do people use tobacco? People can smoke, chew, or sniff it. We're all pretty much familiar with cigars, cigarettes, pipes. Chewing tobacco includes what they call dip, snuff, or little pouches called snus. What about e-cigarettes and vaping? This is a relatively new trend, I guess, for lack of a better word, that's kind of been around for the last several years. And a lot of people have turned to e-cigarettes or vaping as a way to quit smoking. Basically, it's usually a battery operated device that uses water to deliver nicotine, and usually tobacco is not used in these devices, so a lot of people think it's healthier for you because you're not actually using the tobacco. I won't go into too much detail about this, but generally speaking, most doctors will tell you that e-cigarettes and vaping are not a safe alternative to regular tobacco use. There's just not a whole lot of research out there about them to really know kind of what the long-term effects are. Here are some more statistics about tobacco use. As of 2018, the CDC found that about 34 million adults in the US smoke cigarettes. Every day, about 1,600 teens and kids try their first cigarette. Almost 200 of these become daily cigarette smokers. That's a lot of kids. Also in the US alone, 480,000 people die every year because of smoking-related problems. That's almost 500,000 people. Smoking-related illness costs society over $300 billion every year, and $170 billion of that is just in direct medical costs to care for people who are suffering from health conditions related to tobacco use. So in sum, this slide here just goes to show that tobacco costs a lot of lives and a lot of money. Most of us already know the health risks of tobacco use, right? They put these little warnings on tobacco products that they've been doing for years. Most people that use tobacco have had a doctor or some other kind of healthcare provider tell them smoking's bad for you. It's not something that is really a surprise to most people. However, I think that you'll find there's a lot of health problems that a lot of people don't realize are associated with smoking or tobacco use. Cigarette smoking is a major cause of heart disease and stroke. 1 in every 4 deaths from heart disease and stroke is caused by smoking. The risk of developing type 2 diabetes is 30 to 40% higher for smokers than non-smokers. And for folks with COPD, smoking accounts for as many as 8 in 10 COPD-related deaths. If you have asthma, tobacco smoke can also trigger an asthma attack or make your asthma much worse. And finally, cigarette smoking causes many different kinds of cancer, not just lung cancer that most people are already familiar with. Smoking also causes breast cancer, kidney cancer, colon cancer. You'll see the rest on the slide here. Many, many different kinds of cancers. The next risky substance we're going to talk about today is alcohol, another legal substance nationwide that's commonly used. According to the National Institute on Alcohol Abuse and Alcoholism, an estimated 95,000 people die from alcohol-related causes each year in the U.S., making alcohol the 3rd leading preventable cause of death in the United States. We already talked about tobacco, which is actually the number 1 leading cause of preventable death. Number 2 is poor diet and physical activity, which I believe we've already talked about in previous weeks. So when we're talking about drinking alcohol, how much is a drink? If your doctor asks how many drinks do you have a day or a week or whatever, what are they referring to? So in the United States, a standard alcoholic drink is considered 1 12-ounce beer, which is your standard can size, 1 5-ounce glass of wine, which I'll talk a little more about here in a minute, and then a 1.5-ounce or shot of liquor or spirits. And most commonly consumed liquor, like if you're going to go to a bar and order, say, a rum and coke, that rum is going to be about 1.5 ounces of rum in that drink. So a typical container, a wine bottle is about 750 milliliters. That's going to contain about 5 glasses of wine. A standard size bottle that you would see on a shelf in a bar somewhere is also about 750 milliliters. That's going to contain about 18 drinks. And then a liter, which some people refer to as a handle, it's a larger bottle, will contain about 24 drinks. Now keep in mind, if you are pouring drinks for yourself at home, say you are pouring a glass of wine, most people pour a little heavier than what you would get at a restaurant. Usually a wine glass is not going to be filled to the top. So keep that in mind that if you fill your glass to the top, that's probably going to be more than 5 ounces. Also, most of the time people will pour their liquor drinks a little bit heavier. So you might have more closer to 2 or 2.5 ounces of liquor in those drinks that you would have at home. So how much is too much? This is something that many people will have different answers to this. Generally speaking though, currently the recommendations are as follows. If you're male, no more than 4 drinks in one day or 14 drinks over the course of a week. For women, it's defined as no more than 3 drinks in one day or 7 drinks over the course of the week. Now, the differences in gender has to do with not only size, but the way that the body also metabolizes alcohol. So that's the difference in numbers. Also, just a clarification point here. For example, for me as a woman, I should not have more than 3 drinks in any given day or 7 drinks over the course of 7 days. So, for example, say Monday, Tuesday, I have 3 drinks on Monday and 3 drinks on Tuesday. For the whole rest of the week, I can only have 1 more drink. to total that's 7. So it's actually kind of the lesser of the amount here, either the daily or weekly amount. Hopefully that makes sense. And then binge drinking. Many of you have probably already heard this term binge drinking before. It's very commonly associated with college students, but adults binge, or not, the college students aren't adults, but adults out of college also binge drink as well. So binge drinking is defined as having 5 drinks or more in a 2-hour setting for men, or 4 drinks or more in a 2-hour setting for women. And those numbers are different for the same reasons that I spoke of just a moment ago. So some statistics about alcohol use. I won't read these word for word, but overall, alcohol is pretty commonly used among most adults. A survey in 2019 found that about 55% of adults reported that they had drank alcohol in the past month, so you could probably consider them to be current users. In a survey done in 2010, it was found that alcohol misuse cost the United States $249 billion. So think about the numbers related to tobacco use that we talked about just a couple slides ago. That's a lot of money. Probably most concerning to me, approximately 10.5% or 7.5 million children in the US live with at least one parent who has an alcohol use disorder. This is pretty concerning and something that we as a country really need to think about. So what are some of the health risks associated with alcohol use? Well, pretty commonly, liver disease is one that a lot of people already know about. You often hear about cirrhosis of the liver or people dying of liver cancers related to alcohol use. But did you also know that alcohol use, especially people who drink excessively, also have a greater risk of developing heart disease, having a stroke, several kinds of cancers as well. Also, depression is very commonly associated with excessive alcohol use. Moderate drinking, which we already spoke briefly about, 1 drink for women per day or 2 drinks per day for men, is also associated with lots of increased risk of cancers, including breast cancer, esophageal cancer. A lot of times people think, well, if I'm only drinking moderately, it's not going to cause any problems. However, studies have shown that even just 1 or 2 drinks a day can cause health problems as well. Alcohol use during the teenage years can interfere with normal adolescent brain development, which can cause problems down the road. In 2019, of the about 86,000 liver disease deaths that occurred among people aged 12 and older, 43% of these involved alcohol use. So the third risky substance we're going to talk about today is marijuana. Most of you are already aware marijuana has been legal in the state of Colorado for several years now, but it's still considered an illegal drug as far as the federal government goes. So this statistic here, according to the CDC, marijuana is the most commonly used illegal drug in the United States, with approximately 22.2 million users each month. So what are some of the methods of marijuana consumption? Most of us are familiar with smoking marijuana. That seems to be the most common. It's very fast acting. There are also pre-filled oil vapes, very similar to the vape pens used with nicotine that we talked a little bit about earlier. You can also vape marijuana. Marijuana can be found in edible products, beverages. It can be cooked into different foods. There are topical ways of using it, adding it. I believe you can purchase an ointment or a cream or a salve that includes marijuana that people use sometimes for pain. There are tinctures that you can put on your tongue, and then also a pretty common way of using it these days is dabbing. So some statistics about marijuana use. A 2019 Gallup poll showed that 12% of Americans are active marijuana users. About 1 in 10 of marijuana users will end up becoming addicted to it. And for people that you start using marijuana before they turn 18, which is also quite common, that number rises to 1 in 6. Half of all adults in the US have admitted that they've at least used marijuana once in their lifetime. And as of January of this year, 12 states have legalized the recreational use of cannabis, and those states also have legal medical use of marijuana as well for people over the age of 21. So what are some adverse health effects of marijuana use? A lot of people are not aware that marijuana, it can be just as harmful as some other substances. Some people think it's better for you than smoking cigarettes because there aren't as many chemicals in the product. There aren't as many cancers related to it, but there are still some health concerns that are out there that people should pay attention to if they decide they want to use marijuana. So marijuana use directly affects the brain, specifically the area that has to do with learning, attention, coordination, emotions, and reaction time. One of the problems a lot of young people don't realize is when their brains are still developing, if you are using marijuana, that's going to have a really negative impact on your brain. And a lot of studies have actually shown that people who've used marijuana as teenagers have a lot of problems with memory later on the road in life. Frequent marijuana use, or especially using in high dosages, can cause disorientation, and people also can end up feeling really anxious or paranoid, or have some depression as a result of marijuana use. So some other health effects of marijuana use. Although a lot of people think marijuana use mellows you out, kind of slows you down, it actually makes your heartbeat faster. So that can increase your risk of heart disease and stroke. Long-term or frequent marijuana use, especially in high doses, has also been linked to psychosis or even schizophrenia in some users. And finally, using marijuana during pregnancy can increase the baby's risk for developmental problems. Some folks, unfortunately, are incorrectly assume that, again, because marijuana is legal, that it's safe to use even during pregnancy, and this just is not the case. So in the big picture, the question is, why do we use risky substances? If we know these things are bad for us, why do we use them? So generally speaking, people are motivated to use risky or addictive substances for a few different reasons. Now, obviously they vary from person to person, but usually those reasons can fall into these categories. So your past experiences, what you're familiar with, whether or not you have an impulsive or what some people call addictive personality. Some people who struggle with addiction also have problems with gambling or spending too much money or participating in other activities that aren't so healthy for them. Social norms have a lot to do with whether or not people use substances. For example, a lot of people associate college with the partying time, and a lot of people are drinking. It's like the cool thing to do. We also have what people refer to as mommy wine culture these days, which has kind of made drinking wine acceptable, especially for females, especially for moms. So those are some of the social norms. Also your environment. What did you grow up with? If your parents often drank or smoked or used marijuana when you were growing up, it might just seem like it's kind of a normal thing for you to also do as an adult. What's another reason is stress. That's a very common one. A lot of times we think, oh, at the end of the day, I just need a drink to help me kind of relax. Most smokers will tell you that one of the hardest reasons for them to quit is because they're faced with a stressful situation, and automatically when they're stressed, a cigarette calms them down. So one of the big questions then is, how can I cope with stress without using these risky substances, especially if it's something that I always just kind of turn to, that's just habit for me? Like I said before, most smokers will tell you that they have a hard time staying quit because a stressful event occurs and it makes them smoke again. I would imagine the same thing happens for people who are trying to stop drinking or using marijuana or any other kind of substance. Slips and relapses are normal and part of the change process. One thing you'll hear in the addictive counseling world is relapse is part of recovery, and that's true. A lot of times relapse happens. So the important thing to remember is setting some clear goals, having support. Those things are key. So setting goals to start avoiding risky substances, if it is indeed something that is concerning you, is a great way to start with making some changes. Also keep this in mind if you have some friends or other loved ones who are using risky substances and maybe they've expressed to you a desire to start working on cutting down or avoiding those substances. Hopefully some of the information here will help you kind of help them. So a good example of a goal might be, I will swap my morning cigarette with chewing gum at least 5 days this week for the next month. I'll ask my partner to help keep me accountable. I'll use the quit line if I am feeling like I'm having a really hard time and need some support. So this goal is pretty specific, and actually it's SMART goals. We talked about these in week 1. And so some of this will be a little bit of a review for you. But what's a SMART goal? A SMART goal is specific, measurable, attainable, realistic, and timely. So let's kind of think about the goal that I was talking about just a minute ago about the morning cigarette. So specific, what am I going to do to decrease my substance use? Well, specifically, I'm going to swap my morning cigarette for a piece of gum. And measurable, how much will I reduce it by? I will do that 1 cigarette in the morning every day for 5 days of the week for 4 weeks. So that's very measurable. Attainable, do I have what it takes to follow through? I think I do. And what am I going to do to help keep me accountable? I'm going to use the quit line and I'm going to ask my partner for support. So realistically, what can I actually do? I'm not setting a goal to say I'm going to quit cigarettes 100% cold turkey, smoke nothing, because I know that that's probably not going to be a realistic idea for me. And then timely. I already kind of mentioned I'm going to do this 5 days a week for 4 weeks. And at the end of that 4 weeks, I'll reevaluate my progress and kind of see where I've gone from there. So some of this can be useful in just thinking about overall any substances or any behaviors like we've talked about before throughout this course, and using SMART goals can really help. Some other things to help reduce your use of risky substances can be counseling. Sometimes medication is a great resource, obviously something to speak with your doctor about. But it seems like the best effective treatment is a combination of counseling and medication. These might be great things to also recommend to your friends and loved ones if they're struggling with some risky substance use as well. So we already talked about stress in a previous week of this program, but I wanted to just reiterate some healthy ways of coping with stress. Since most of the time we can associate risky substance use with stress, here are some ideas in addition to what you've probably already learned about how to help cope with stress. Listen to music, talk to a friend, laugh. Laughter is the best medicine. We've been hearing that for years. Get moving, get physically active, even if it's just going for a walk for 10 minutes. If you're feeling stressed, I guarantee at the end of that 10 minutes, you'll feel a lot better. Be mindful, be present in the moment. And most of all, don't forget to breathe. Here's some resources for you if you're interested. Feel free to pass these resources on to friends, family members, or others that you feel might be interested in learning some more information about how to avoid risky substances. and some more resources here as well. Thank you all so much. I really appreciate your attention, and I hope you enjoyed the presentation today. Bye.